right, guys, we're here. We're doing it finally. Friends of Medicine podcast. Welcome.
All right. Fantastic.
Thank you for having me.
Thank you for coming.
Super excited.
Yeah, this is great.
Excellent.
This is going to be great. So for those of you who don't know, my name is Dr. Andre Coombs. I'm a trauma surgeon here in Miami. I am the founder of Friends of Medicine. It's an organization that I started about 2 years ago to assist with healthcare professionals, whether you're a nurse, a med student, a pharmacy student, surgeon, get together and network with the business community. There's a very big gap between our knowledge and access to these types of professionals. And I wanted to help fill that gap. You know, a lot of people say doctors don't know anything about finances. We have no time to take care of our own finances. So we bring those experts to network with us, and we want to develop these long-term relationships. So we wanted to start this podcast to help bring awareness to the foundation, to educate people who are not doctors about things in healthcare that affect their lives. Plastic surgery was the first topic we chose because we're here in the Mecca of plastic surgery.
That's right, the Mecca.
Right here in Miami. So right now we're in beautiful Brickell, and we're going to shoot this podcast here and have some fun. Just talk and get to know each other and answer some questions. Hopefully some people will learn something. Let me allow Nina to introduce herself.
Hi guys, I'm Nina. I am an influencer. I've lived in Miami for 3 years. I can definitely confirm that it is the Mecca of plastic surgery. Definitely a lot of social pressure here to enhance your body. And yeah, I'm a fitness influencer. That's about it. Natural. All natural, 100%.
What's your Instagram page?
That's incredible.
Thank you. Nina the Pineapple on Instagram.
Awesome. Go check her out. You'll see she's the real deal. Kevin?
So my name is Dr. Kevin Mosca. I own Mosca Plastic and Reconstructive Surgery. I practice in Fort Lauderdale. I came down about 6 years ago after graduating from a lot of education in Philadelphia. And I always wanted to be in Florida. It is the Mecca of plastic surgery. It's less of a stigma to practice cosmetic plastic surgery here. It's easier to get the patients. And if you bring a strong work ethic, it's even easier. So, I came down, like I said, about 6 years ago, and I built myself up quite well. Most people know me as Dr. Boca Raton on all social media platforms.
Yep.
I just ventured out and purchased Strex Aesthetics. I am now a 50% owner in what used to be one of the quote-unquote chop shops that were changing the way things are done down here.
Very good. I'd love to hear more about that in a bit.
We will.
So I think, Nina, a good perspective to start is, like you said, the pressure that some women might feel here living in South Florida and in a lot of metropolitan areas around the U.S. that you feel like you have to enhance yourself. And there's nothing wrong with that from my perspective. But the pressure, the psychological pressure that you feel like you have to fit in and meet these societal norms now, it must be something pretty challenging to deal with on a day-to-day basis, especially with a fitness career as yours, right?
Yeah, I literally get so many DMs and comments from people telling me that I would be perfect if I was to get a boob job. Oh,
wow. And they're being for real.
No, they're being for real. Like, you're perfect. You have an amazing body. If you were to just get your boobs done, you'd be perfect.
Wow. How do you feel about that?
I mean, deep down, it does make you, consider it. I'm not going to lie. I have definitely entertained the thought of plastic surgery, but I've always viewed it as something that's risky, kind of dangerous, and can, cause long-term health effects. I know people that have gotten illnesses due to implants, or I don't know, I'm scared of bleeding out in a surgery, or my body rejecting it.
Oh, trust me, Kevin and I have some stories, I'm sure.
Yeah, absolutely. We can tell you all about it.
Yeah.
I've always viewed surgery as something that you get for health conditions, or reconstructive, or trauma related, but not really cosmetic, because how many surgeries in a lifetime can your body really take?
Right. Kevin?
Well, I really value that point. Every patient that I see, and I make a point to see every patient prior to surgery. And that's even rare down here. People are signing up for surgeries in Miami just because they feel that pressure. And some of them don't even meet the surgeon until they're literally going into the OR, which is a big problem. And, I just model myself completely differently. I meet every patient. I go over the risks, the benefits of having a surgery. It is a surgery. You know, as she said, there is some risk to having surgery, any kind of surgery, and we have to go over those things with each and every patient because each surgery has its own inherent risks. And it's very important that the patient understands those risks and the benefit she's going to get, but the risks that are undertaken.
Yeah, they're very real risks because I've had some pretty routine cases come to me as catastrophic, life-threatening, and sometimes fatal complications.
And it is surgery. I mean, nobody is perfect. It's based on, you know, there's human error that's going to happen sometimes. And we have to all understand that nobody's perfect and not every surgery is going to come out perfect. And some of the, you know, it could be something, like you said, as catastrophic as ending up in a hospital or an ER with a bad outcome that we don't want to happen at all costs, or versus, you know, somebody who's just not happy with their results and has kind of unrealistic expectations because of the world of social media right now. Right.
I'd love to touch on that a little bit because, you know, I've heard and I've seen reports where plastic surgery in particular, of all the surgical first of all, the surgical specialties have the highest depression rate, highest suicide rate.
That's correct.
And I remember reading a few years ago that plastic surgeons have one of the higher ones in that category. And I think it was because patients are not really satisfied.
Yeah.
They want to sue every minute.
Basically, we're psychologists with a knife.
Oh.
So, I mean, you know,
I like that.
It's very hard to be a patient psychologist and explain to them realistic expectations when they're looking at photoshopped pictures on Instagram and thinking they need to achieve this perfection. And it's not really perfection. It's just photoshopped. And I spend time going over, even showing some of the areas that are photoshopped with patients and saying, you got to have realistic expectations. I mean, there are a bevy of beautiful women in South Florida to do plastic surgery on. And yes, it's an exceptional place to practice cosmetic surgery. But this is an environment where people of all shapes and sizes think that they deserve or can look like something that's unachievable, and they go after it and go after it and go after it to the point that it becomes detrimental to their health. And that's the problem.
Yeah. Nina, how often do you encounter women in your physical fitness practice that have experienced this kind of pressure?
I mean, on Instagram right now, like all of the top models, you know, the highest paid models, they all have plastic surgery. So I think that's where like the social pressure comes in. You know, you think that, well, maybe if I had bigger boobs, like if I had fillers or Botox, I could, you know, do that well. And I mean, it's true. A lot of these girls that do have enhancements, like they're so praised and idolized because they've reached a level of beauty that's kind of like unrealistic.
Right. I actually know a few on Instagram that I met before they blew up, and I thought they were much more beautiful before they did all of that stuff.
Oh, all the time. And I get to meet a lot of blue check women. You know, the ones on Instagram have the blue checks and verified, and you know, you see them in person and they don't look anything like they do in pictures. And you know, it brings a real perspective to the field when I can bring that to other patients and tell them specifically, you know, this is it's unobtainable because it's fake. It's totally photoshopped. Right. It's all smoke and mirrors.
Now, don't get me wrong. I appreciate a well-sculpted gluteus maximus.
Absolutely.
I appreciate that. And I don't judge when it comes to whoever wants to do or enhance themselves to, you know, gain more confidence. I mean, we don't know what people are going through. We don't know their situations, their circumstances, what their job may have told them they needed to do in order to get a raise, you know.
That's right.
So, you know, I don't judge when it comes to that. And I support anyone who wants to better themselves, whether it's psychologically, mentally, physically. What I, you know, have an issue with and feel for some of these patients is when they feel forced to and they don't need to, and then something goes terribly wrong.
Yeah.
And they never knew, they never were aware that you can end up in an ICU on a ventilator through a tracheostomy with a feeding tube and your entire abdominal wall gone. Like, they have no comprehension of that going into this. And that's what, you know, I think part of the reason why I wanted to do this podcast is to bring some awareness to people who are considering it that don't necessarily need to have it, so that they understand that there are some serious life-threatening risks also, along with all the benefits that come.
Yeah, I think it's a good idea that we go over, you know, a little bit about what patient who is interested in plastic surgery should look for in every aspect of choosing that plastic surgeon. Is it the correct procedure for you? And, you know, obviously the risks that can happen, but what you should expect in a consultation, what you should look for before just booking a surgery is very important.
What I'd like to touch on before we go there is just for our med students and a lot of these kids, colleagues. I'm a little older, I don't look it, but a lot of these kids come to me and they tell me, hey, you know, I'm interested in plastic surgery, I'm interested in trauma surgery, and they don't know what they're getting into at all. You know, can you just touch on what the journey and the path is to become a plastic surgeon here in the US?
Sure. I give this lecture actually almost every year to the medical students at Nova. So it's
Awesome.
a great lecture. I do it virtually. But basically,
Can you do it in 20 seconds?
no, I can try. Basically, it's a long path to become a plastic surgeon. You have to go through medical school. Usually there's some research involved, and then you get into surgical residency, 4 years of medical school, maybe some research, at least 3 years of residency in general surgery if you're integrated, and then you do 3 years in plastics. So you're talking, sometimes 8 to 10 years after you've graduated medical school. Some of these guys are coming out with fellowships, then possibly in cosmetic surgery or craniofacial or hand and the various things they have to do to get there.
Almost 15 years.
Oh yeah, totally. With med school involved, 15 years.
Yeah.
So it's a long haul and a lot of sleepless nights, and you have to do a lot of stuff you maybe didn't think you were going to have to do plastic surgery. I always wanted to do cosmetic surgery in South Florida. I didn't know I'd be doing, fixing dog bites and hand and mandibles on drunken patients who come in from bar fights in the middle of the night.
Welcome to my Friday
welcome
night.
to that world. You guys call me.
That's crazy.
Yeah.
So how do you compete or compare your training with, say, someone who did a 6-week course and is doing lipo and making a ton of money, but sending a lot of patients to the hospital?
Yeah, I mean, there's the 6-week course, there's the weekend course, there's the people who are signing the doctor's forms that aren't even doing the surgery in South Florida. And that's the scary part. I mean, you have to have skills to feel what's changing in a patient's body as you're performing surgery. You know this.
Can you give us an example of like a typical operation where that really matters?
Liposuction matters. We're making small incisions, very small.
Take us through liposuction.
So a liposuction procedure, the patient's asleep, and you make small incisions in strategic areas that hide within clothing, panty line, bra line, whatever you can to hide it, 3 to 5 millimeters. And you're using long cannulas that are narrow, 3 to 5 millimeters, and you're sucking fat out underneath the skin, but above their muscles and such. You have to be able to feel that you're in the right spot. And, in plastic surgery in general, some surgeons aren't even doing their liposuction, and that's kind of dangerous down here. They're either reached past beyond their peak, or they're older, and somebody is assisting them to do it down here, and they haven't gone through the medical training. They haven't dissected human cadavers or gone through all of the 15 years we just talked about in possible training. And that causes problems. And I think one of the bigger epidemics down here is that it's like a race to the bottom. These surgeons are charging real cheap money to get people from all around the world to come down here and do 8 cases in a day. And they're not doing 8 cases in a day. I can tell you, I'm not in horrible shape. I'm not in great shape, but you can't do more than 2 lipos, maybe 3 at the most in a day without dying. I mean, you're exhausted. It's cardio workout for about 2.5 hours straight. Right. So these guys who are doing 8 cases in a day, they're not doing 8 cases. They have assistants on either side who are basically like harpooning the patients with these liposuction cannulas. And these girls have no idea because they just came for a cheap plastic surgery that they think is going to change their life and their body. And it's horrible. They don't even meet the surgeons before they go in. And this is what's going on down here. And these are the patients that you end up seeing in the trauma bay and the ER and dealing with severe consequences because they don't know any better. They don't understand the importance of value of seeing a surgeon and paying significant money because that surgeon's doing the surgery for you.
Did you have any idea about all of this behind the scenes stuff, Nina?
I follow Dr. Miami on TikTok.
Oh, nice. I think everyone knows about Dr. Miami.
Yeah, and he always talks about people wanting to lowball him because they're so used to getting cheap quotes from other surgeons.
Absolutely.
It's like you get what you pay for, though.
It's 100% true. And Florida in general is it's cheaper to begin with. Even the surgeons such as myself who charge, I feel like a reasonable amount, it's still a lot cheaper than Beverly Hills, New York, and other areas that you practice. I mean, you can change your whole body with a quality surgeon down here for still way less money than anywhere else in the country because there's so much plastic surgery here. It doesn't need to be a race to the bottom. And it's starting to change. The board is changing to limit surgeons to hopefully do 3 cases a day. And we brought in the ultrasound for the BBLs that we have to use now. And that's really important as we want to see fewer and fewer fatalities due to Brazilian butt lifts.
Is that now a requirement?
It's been a requirement, yeah. We have to use an ultrasound to show where the fat is being injected in the buttocks so that you're not going deep to the muscles.
Okay.
It was presented last year when I was here right down the street at the Baker Gordon conference where the greatest plastic surgeons give a talk almost every year in February, at the beginning of February, and they talked about it, and it was signed into law.
Okay.
Probably 6 months ago or so, and we've been doing it ever since.
Right.
What's the average cost of a plastic surgery like a lipo?
For me, I usually charge, depending on what areas we're doing, could be anywhere between $7,000 to $10,000.
You mind if we put a before and after of some of your lipo?
Oh, absolutely. Yeah? You can show anything you want.
get
these
that, pull that
customers,
up.
like, do they pay cash or do they finance it?
I don't really get involved with the financing. I have an office manager who's great. She manages my entire life, but basically, she handles it. But you can finance it. You can pay cash. It's all good.
Have your sugar daddy pay?
Yeah. Oh, that's I see Dr. Miami. He posts about that all the time. And yeah, that's totally true.
You see a lot of that?
Oh my God. Yeah. The guy will come and pay for the surgery is not the guy who shows up at the post-operative appointment.
Oh yeah.
Oh my God.
Yeah. It's crazy down here. It's crazy.
That's just reality,
City girls.
It's so crazy down here.
That's why this is unfiltered, guys. We're touching every topic. We're talking everything. We're not holding back.
No.
Let's just keep it real,
Absolutely.
This is what happens.
Absolutely. So I have a question for you. You have a great shape, but why would you even consider doing plastic surgery if you have? What makes you think about it? Because people DM you. You don't even know these people.
I'll tell you that one girl I showed your profile to, she was like, she has the perfect body.
Right.
And I'm sure you've heard that before.
Thank you. I think it's just social pressure, because I've been an influencer for 4 years. And I'm one of the very few in my community, like in the fitness influencer world, that's like 100% natural. I don't have any.
That's great.
I don't have any like enhancements. I don't have anything, nothing at all.
True minority.
Definitely a true minority down here.
So, seeing so many girls that they're like doing so well and they have plastic surgery, it kind of makes you think like, well, maybe I'm missing something. Maybe if I was.
What percentage of these girls though regret doing that despite the success and the glamour and the attention and everything? I'm sure a lot of them
nobody talks about it.
Yeah,
nobody talks about it.
Because
so
I can tell you they come in and they're depressed
because of like
they can't meet that expectation that they thought they would meet, and then they regret everything that they did. They get a complication, and there's nothing much you can do. You can't reverse some of it.
And it only gets worse the more you do it. I mean, these women who come in, I don't even do second round liposuctions. Down here, I learned so much terminology, but basically when I started, there's like, do you do round 2s and round 3s? I'm like, what is that? And in the beginning, I kind of started to try and do it, but it's basically women who have had liposuction and then they want it again. So the whole concept of liposuction is that you're kind of using a cannula and you're forcing it through fat, and that force through physics is going to, the trauma force is going to bring fat with suction through a cannula via resistance. So the problem is, as you keep doing it multiple times, patients form scar tissue or fibrosis, and you have to use more force now to push that fat through the cannula.
New blood vessels have
Correct.
formed there.
Now you have hyperemic tissue, which means that it's irregular blood supply and can bleed more. Not only that, but you're pulling scar tissue out and you're forcing the cannula harder, so you have a higher incidence of actually entering somewhere you shouldn't, like the peritoneum and internal organs. And that's why patients sometimes end up getting truly harpooned, is because the assistants, who really can't feel as well anyway, are going into areas they shouldn't be with liposuction.
So just educate us on the general anesthesia, local anesthesia when it comes to that.
So,
and for those of you who are tuning in and don't know, general anesthesia is when you're fully asleep, you're in a medically induced coma for surgery. Local anesthesia is when we inject the skin and the subcutaneous tissue with local anesthetic, so you're awake, you're alert, but you can't feel what's being done.
That's so scary.
It is incredibly scary. And as the surgeon who's operated in rooms next to those surgeons doing the liposuction, hearing those patients scream, it's like a horror show. So, tickle lipo or air sculpting and all these local liposuctions, number one, they force the surgeon to be in an uncomfortable situation because he is liposuctioning you while you're awake. So the typical music isn't playing that the surgeon's used to, and maybe the banter's not going on, but realistically the focus is on you not having pain instead of your results. So surgeons are trying to do what they can do to remove fat in areas without giving you pain. Well, some of these areas, to get the results kind of that I do on Instagram, they're going to be painful. If you want your rib area sculpted and your abs sculpted,
never thought about that.
You have to get to those deeper areas, and it's just a painful experience. So yes, you can do liposuction under local. It's typically meant for more of a debulking type procedure in a larger, maybe, slightly obese patient. Mm-hmm. They won't feel as much, but you're not going to get sculpted results on athletic bodies, without doing general anesthesia. You need to do general anesthesia. The patient needs to be comfortable. The surgeon needs to be comfortable. The muscles need to be relaxed, so you're not, getting into a tense area and the patient, moves abruptly while you have that cannula inside of them. It's just not a good situation. I tried it when I started, and I said, this is not safe. And immediately I aborted that, even thought of trying to do that when I started maybe 2 or 3 cases.
Mm. We talk about women and plastic surgery, but there's a lot of men.
A lot of men starting to do it.
A lot of men coming in with complications. They're getting BBLs.
Yeah.
Men are getting BBLs?
Men are getting BBLs, but
Trust
men,
me.
it's a totally different anatomy. It's not as safe because men have more muscular tissue developed in their buttocks and less subcutaneous fat. That gives you less of a distance to actually place the fat that it'll survive. So you're going into the buttocks and you're hitting the muscles and you're getting into dangerous situations.
Is there like a limit as to how deep you can go with the...
Yeah, and that's what the ultrasound's for. You're not supposed to go into or below the muscle. The muscle has a little protective barrier called fascia. It's like saran wrap, basically. And you don't want to pierce that because if you do, the fat can go through the muscle and into the area where the blood vessels are in your nerves, and it can cause what's called a fat embolism. And that goes to the patient's lung and they die. And that was a big problem down here in South Florida because people were doing surgeries as fast as they can to make as much money in a day as they can, and they're not actually doing all their surgeries.
So surgeries, plastic surgery, like can be deadly.
Absolutely.
I feel like so many of these influencers, they've kind of made it out to seem like getting plastic surgery is as easy as like a dental procedure.
Well, again, it's in the right hands, it's a very safe procedure. There are statistics for each procedure. You know, in the right, correct way of doing things, a BBL event is like 1 in 15,000 as opposed to what it was originally posted as 1 in 3,000. You know, if you're doing it correctly, and that's better than tummy tuck actually events. And tummy tuck could be like a DVT, meaning a clot in your leg that, you know, gives you swelling and or could give you a problem breathing later on. But there's risks with any kind of surgery that we go over with each and every patient. Breast implant illness, breast implants, what happens, capsular contracture. There's many things for each procedure that you need to go over with each patient.
You know, I'm sure there's patients who've been through this, have had the devastating complications that would be willing to share their story and come and educate people.
You were telling me about the patient that you had taken care of recently, and you want to share about that?
Yeah, so I can't divulge any information, directly, but there was a complication where the liposuction cannula went through a hernia that was not seen, and it went through the bowel, through the colon, injured everything, and it was delayed. It wasn't noticed initially. So they went into septic shock. There was stool in the abdominal wall, etc., and the patient came in almost dead.
And that's basically the equivalent of like a gunshot.
Yeah. Oh, yeah. Basically, as sick as any polytrauma patient. Had to take it to the operating room, remove all the skin, and of course, being on the ventilator for long, tracheostomy, feeding tube, something you would not expect from a routine liposuction.
Yeah.
I can't say which state that was in or, any information about where, but it happens, and it happens pretty much everywhere.
It happens, and the technology is getting better. It's just you have to spend some money to have this technology. There's what's called a micro-air PAL system, physician-assisted liposuction, so that it vibrates really quickly, and it takes away the necessity to really hard forces to get in there and do the liposuction.
I'll show a little video of what he's talking about. What is it? What's the procedure?
It's called my technique is called SAFE. SAFE stands for separate, aspirate, and fat equalize. It's a 3-step process in which you use less force to give better contours for liposuction. So I use a micro-air system, which is basically it vibrates very quickly back and forth, and it assists getting the fat out, so you don't have to jam the cannula in as hard to obtain fat. It also gives smoother results by you can basically sand down your results and give nice contours. You can take more fat and not worry about like the lumps and bumps that typically occurred 10, 15, 20 years ago with liposuction.
Are these long-term results?
It depends on your weight management.
Question.
It's a great question, actually. I always counsel all patients that, within 10, 15 pounds, yeah, it'll still look good. But if you start gaining 20, 30, 40 pounds, it's not, because we're physicians, not magicians. So basically, I'm taking the fat out by feeling it. When it feels smooth, I'm done in that area. But I don't have microscopic vision. And if you, as a fitness person, if you take in more calories than you burn, the fat's going to expand again. So that the fat cells that I leave behind may not be perfectly even. So now when they grow to take on this extra caloric intake, it's going to look uneven beyond a certain point. So like I said, 20, 30 pounds is not okay.
So that's like when the botched look comes in? Yeah,
or it doesn't have to just be that. Like I said, it's not always caused by weight gain. It can be caused by just poor surgical technique. These guys who have liposuction somebody 2-3 times, they have uncontrollable scar tissue underneath their skin, so they look botched. Or, it's called fibrosis. It's an uneven look.
Can patients work out after surgery?
Yeah, typically there's a recovery period of about a month to 6 weeks, 4 to 6 weeks, where we say don't lift anything, don't exercise kind of stuff.
I have an uncle who's a cardiologist. Like, he does open heart surgery, and
nice.
I used to be very vocal about not not doing plastic surgery on Instagram, and he follows me, and he was like, Nina, you need to stop going against plastic surgery and start selling post-surgery workout programs.
That's true. Absolutely.
Nice.
Especially down here. It'll be fantastic.
Massages,
the lymphatic massages are super important. These are all things I learned within the past 6 years down here. Like the post-op care is incredible with the great South American, Central American influence. It's really changed the way liposuction is done. Yeah, the post-op garments you have to wear, the stuff that makes you contour nicely is all really important.
So most of your cases are done as an outpatient?
Yes, all of my cases, they go home the same day.
And how long do you monitor them after surgery? Like
typically 1.5 to 2 hours before they go from PACU, the post-anesthesia care unit. Basically, they're going to go home afterwards. I am always available, which is, I guess we were going to talk about sometime, like the lifestyle of a plastic surgeon.
Yeah. Let's talk about it right now.
I mean, I'm readily way too available, and
I don't like that. I like to be unavailable when I'm home.
And again, we talked about this before, pluses and minuses of the different fields. If I don't answer the phone, they'll go to the ER, and it just becomes a worse problem. So I am always available via Instagram to all my patients, and any one of my patients who's listening to this or sees this will vouch for that. I
thought I didn't sleep.
I call every patient the next day, if not at night, to check on them, me personally, and then I see them each and every post-op. I do not have a nurse practitioner or anybody follow up but me, because I want to evaluate the results each and every time and tell them what they're doing right, what they're doing wrong, and I don't want anybody messing with that. So
do you find yourself having to go to see them and examine them because you can't assess over the internet?
Yeah, I mean, I can't treat certain things over verbal texting dialogue, but if anybody has a problem, I just say, just come in and see me. I'm going to make myself available to that person. They trusted me to do their surgery. They paid me money to go to do their surgery, and there's a lot of choices down here, and I try and make the best of every situation for that patient so that they understand that they're well taken care of. And when you have a plastic surgeon, I feel like it's a good relationship with the patient feels like you are their person, and it's just different than any other type of doctor. I mean, they don't even want to wait.
I mean, you cut them open.
That's true.
And gave them the body of their dreams. So
yeah, hopefully that's the goal. Like I said, it's a lot of psychology, but yeah. I mean, you really want to be on top of it, because it's a cutthroat business. If you don't take care of them, they'll go somewhere else. And when you are 100% cosmetic driven, as I am, this is a business that has ups and downs, that when the economy's good, when the economy's not good, all that stuff. So you have to be on top of the game, just like, be the first one in the room, the last one to leave, all that stuff. It never stops. So I appreciate that you do shift work sometimes.
I love it. I wouldn't trade it for anything.
Absolutely.
Does it cost a lot of money to perform plastic surgery?
Yeah, and that's what people don't understand. They think, oh, he raised his prices. He's just trying to get more rich. No, I mean, everything in medicine has skyrocketed in the past 3 years because of what's been going on, and the prices went up 20-30% because we had to cover costs to get medical supplies. Surgery generally costs about $1,000 to $1,500 an hour to do. Yeah. So when we charge a certain amount, it's not that unheard of that most of it is going to the staff and paying. You have overhead, you have office. The more glamorous your office is, I don't have a very glamorous office. I believe in passing on as much savings as I can to the patient. I have a nice office, but I don't have all the marble palace, columns and all that stuff. But yeah, you have overhead and you have things you have to pay, and ultimately it gets passed on to the patients that way. So you have to try and control costs as best as you can. But, every year it goes up a little bit.
I was going to say, so they pay for the surgery, and then there's drugs that they have to buy post-surgery?
Yeah. You're going to get medications. Typically, I give you an anti-pain medication or to help with narcotics, and it's to help with pain. I give you something for nausea because I don't want you getting nauseous, and an antibiotic. Usually your insurance, if you have it, covers it, or we have, multiple ways of getting discounted medicine.
What does a masculine BBL look like?
I don't know. They all look the same to me.
But how is it different to a female's BBL?
Well, it's where you put the fat. I mean, honestly, you gotta. This is again why
it just looks like a big booty.
You gotta go to a quality surgeon, because realistically, men, their fat should be more central and in the center of the butt, whereas most women want more hips and the upside down heart shape. So where the fat is positioned is two different areas. Men have a stronger indent on their buttocks, and it should be not filled up with fat. That wouldn't look good at all.
So men have more hip dips.
Men definitely are supposed to have more hip dips.
After the show, I'll show you. Actually, when I was training for the Olympics, I was at my peak athletic performance, not now. I'm a bit of a dad bod now. But you have that definition, that dimple, that deep sulcus in the lateral part of the
And that's a good look.
glutes.
That's what it's supposed to be.
And I think that's what they're trying to emulate.
What sport did you play?
Oh, I did the long jump, and I also played soccer. We call it football back in the Caribbean.
So you were like Olympic level. That's crazy.
Yeah.
That's awesome, man.
What made you want to go into the medical field after being an athlete?
I did reach the Olympic level to qualify for Beijing, and 6 weeks before the games, I tore my hamstring in the New York, the Long Island Games in New York. So I never got to my trials to go, but I was at that level for sure.
Wow.
So I mean, because of that injury, it taught me, that medicine, I should just focus on that.
Yeah.
Yeah.
It's a good transition, though.
But I mean, honestly, when I was applying to med school, I had the opportunity to go the soccer route. And to this day, sometimes when I go home, people say, "Oh, which team are you playing for?" Because they thought I went that route. So those are my two stories: long jump and soccer. And now I play golf.
That's like totally different.
I know. Yeah, I actually enjoy golf the most. It's like a challenging sport. You play against your own mind, And I get to play with my son. It's the most beautiful thing in the world.
Yeah, that's great. Yeah. It's nice.
What about you? How did you get into the fitness? What's your story with the fitness world?
So growing up, I always wanted to have a fit body. Like I just always wanted to have abs. I was mostly drawn into abs.
Abs, not ass, abs.
Abs.
Okay.
Yes, because I was born in 96.
Yeah,
I was born in 96, and like for any kid that grew up in the 2000s, it wasn't very socially acceptable to like have a big ass.
I know. I remember those days.
Yeah.
What
The
a
Kate
time-
Moss days.
What a time that was.
Yeah, the Kate
Moss
Moss
days. Yeah. See, I'm older than you guys. I was like already a freshman in high school.
Really?
Yeah.
Wait, how old are you?
40.
Oh wow.
Oh, okay.
Yeah. See,
You don't look like it.
I know.
I do
thought
get a
was
little
older than you.
Botox, though. I do get a little Botox. Cheater. I know.
Okay.
Hey, listen, you got to cheat the system somehow.
You don't look like it.
Thank you.
So yeah, I just always wanted to be like stick figure because that's what was that,
Societal expectation.
Right.
right.
Yeah.
That was a beauty standard back then. But I couldn't really I was a kid, so I couldn't really afford a personal trainer. I would just like do crunches, ab crunches, and that's it. And then when I turned
school.
18 and I started working, I paid for a personal trainer and I learned how to work out. And I'm 26 now. I've been working out ever since.
Well, it paid off. You look amazing. Your page, pull up her
Thank you.
Instagram page.
Yeah,
so people can
congratulations.
see her and follow her. She's
Thank you.
an amazing.
It's
fitness
very hard to
expert.
do this naturally. I can tell you. I see a lot of people.
Oh, it's impressive.
Congratulations.
Thank
It's
you.
fantastic.
I love working out. I mean, like literally my happiness depends on working out.
How often do you work out?
I
And for
work
how long?
out 3, 4, 5 times a week, depending on, how you feel.
For how long? Are you one of those short and quick, or like get it for like 3 hours?
No, I'd be in there for like 3 hours.
Wow.
Damn. I can't do
Yeah.
that.
Once you see results, it really just becomes addicting and you're not going to fall off. But you have to be patient because you're not going to see results in a week or 2 weeks or even a month. Like you're going to see results after a year. You're going to start to feel like your body just getting like.
So this is a non-cosmetic surgery part of the discussion, right? Where
Right.
we talk about working out and getting it natural.
No, but I actually have a question for her because these patients always ask me afterwards, like, how do I develop my butt? And I always tell them that they need to lift heavy and they should lift heavy, not reps. And I just want to know if that's correct.
I don't think so. Like me, for example, I don't enjoy lifting heavy. I don't think it's good for your joints.
No, it's definitely not. I'm
Right,
not saying
I
it's
don't-
good for it, but to develop the gluteus as big as you can, I think.
opinions vary, Like there's a school that believe in the heavy lifting.
Right,
And then
I
there's a
just
school
wanted to
that
ask
do
her.
the high
But I like
reps.
to look at fitness as like a long-term game and something that you can maintain for the rest of your life. So I'm more about
the long haul.
right. Like you want to have healthy joints for the rest of your life because once your
Sure.
knees start to wear out and your lower
Absolutely.
back hurts, like you're out. That's
No,
it.
I know.
You can't restore those things. So I don't think it's necessarily true that you need to go heavy to
Okay.
grow your glutes. I think you just really need to focus on using the muscles accordingly, like really feeling the muscle working and booty isolation workouts.
Booty isolations.
Yeah.
Yeah.
And just being consistent, like eating healthy and eating enough. Everybody's different, right? Like some people are more genetically disposed to grow their glutes.
Sure.
Other people not really. So I think, if you want to go the natural route, I guess you have to really like accept yourself as you are and understand that your body might not look like the fitness influencer that you follow, right? Because maybe she's more genetically disposed to like grow her glutes and like store more fat there naturally.
Right, good point.
So you have to really just work towards being like a fitter version of yourself.
Right. And that's what I try and tell. It's the exact same mantra, so to speak. When I do plastic surgery, I can't make you look like Kim Kardashian. I can make you look the best that you can obtain surgical results. That's what you have to instill in them. Your curves, your skeletal structure, your muscle development, the way you harvest fat and where it should be and where it will take. It's really up to your own body. I can't make everybody look like a Kardashian.
To achieve the supreme physical physique that you have right now, is would you say diet is more important, or is it more like a 50-50 balance, or is it
I think
more
it's a 50-50 balance for sure.
I hear a lot of, it's a more diet, and maybe it's different for different people.
It's definitely 50-50. Like you can eat kale all day, right? Like kale, salmon, and I don't know, like oatmeal. But if you don't work out, it's not going to really do anything for you.
But if you work out a lot and you eat junk, I know a lot of people that eat a lot of shit and they look amazing.
But you don't want to compare yourself to like those very rare exceptions.
Right, that's true. That's true.
Those are just like genetical freaks that, you don't want to
always drove me nuts. My brother had abs since the day he was born, and he ate like Tootsie Rolls every day of his life, nonstop, and I could never have abs.
Some people just get really lucky, and I think that's what it comes down to when it comes to like comparing yourself to how other people look.
Right.
It's kind of like, some people, they're just born genetically gifted.
Have you ever done any of those genetic tests where you can like see what type of protein or whatever suits you, and
Yeah, I did. I did the 23andMe and the nutrition profile and everything. It's very interesting.
Have you ever done that? Have you used that in your practice? Like a genetic profile to see what foods suit you for the purpose and the goals that you're trying to achieve, whether it's weight loss or muscle growth, etc.
No, so I kind of reached a point in my fitness. Like, I just feel really happy. It's very sustainable for me. So
you just maintain it.
I'll just maintain
it.
What about, so I want to touch on the bio-sculpting, the body sculpting, like the M-Sculpt and these handheld devices that people go and spend hundreds of dollars on.
Tell me about
it. I've seen some before and after pictures that are out of this world, and I'm sure it's complemented with like working out and diet, etc. Maybe some plastic surgery here and there.
I think it's all complemented by like the patient just spent $2,000-$3,000 on something that doesn't work, and they start changing their life and they try and look better for themselves.
Right.
Regular fitness. I'm not going to talk bad about any one company, but there's no substitute for the actual surgery or doing it yourself.
Right.
There's just not.
But there's a role for that kind of non-invasive.
There's a role for non-invasive stuff, lasers for skin tightening and dermal abrasion type stuff, CO2 lasers, which help tighten the skin and remove fine wrinkles, or IPL lasers, which help remove blemishes, sunspots, all that stuff. Right. Absolutely. There's definitely a field for that. And I love it.
I'm glad you said that, because I have one right there.
Oh, look at you.
I just bought it in San Diego.
Yeah, no, there's dermatologists that make their entire living off of that. Because they can't do surgery, but they buy all the stuff that's cosmetically associated.
If those before and after pictures are legit,
absolutely
very impressive.
Yeah, and they love all that stuff. And I just think that some of it really does not work, and some of it may work a little bit.
And someone who may not be able to tolerate general or even local anesthesia or even a haircut would probably benefit from something like this.
Correct. But there's totally different things. You're talking about, like, getting an IPL peel an IPL laser or a facial peel versus, hooking something that's going to freeze your fat away onto your abdomen. And sometimes patients actually grow fat in that area. Instead, idiopathic hypertrophy of the fat is what it's called. And they get it.
What do you do about that when it happens?
When that happens, I don't have those lasers for these reasons. I make my living doing surgery, and I don't buy coat hangers. Those things every year.
Is that something that's like cosmetically obvious? Like,
absolutely.
Can we pull up a picture of that? What is it called?
It should be idiopathic hypertrophy. It's a tough thing. You want me to skip it for you? Idiopathic and then hypertrophy.
Interesting. Okay.
Of fatty tissue. It's the opposite of what you want to happen.
Right.
Basically, it just shows that people are, they either gain weight, and maybe it's because they increased their diet thinking that they were going to lose weight using this machine, and they figured they could cheat the system and just keep doing it.
Right. So, Nina, if you wanted something done, I'm not going to ask what, but what questions would you want to have your plastic surgeon address? And then, Kevin, you can talk on the person that you select to do this particular procedure on you, What should they educate their patients about? Let's talk about that.
So What I entertain the thought of the most is like getting a boob job.
Sure, of course. It's very
so
common.
I guess I want to know if I was to get a boob job in the future, how would I prepare myself? Because I don't, like the risk comes in if I'm like deficient on something, right?
I mean, if you're, again, this comes back to seeing a surgeon who's going to treat you medically and make sure that you're in the best shape that you can be for this procedure. I typically draw labs on everybody. I make sure that you're hemodynamically stable, meaning that you have good blood counts and you could tolerate bleeding a little bit if you did. We get an EKG, make sure your heart's up for general anesthesia. You're young. I take a full history, make sure that you don't have anything I should send you to a doctor for, and make sure that you're cleared. But you're young, healthy, avid fitness person. Typically, I just get basic labs and an EKG, make sure that all looks good. Once it looks good, we would have a good consultation talking about size, what your expectations are, what you're looking for. And I measure, certain things on your breast, tell you what we can do, what we can't do, because you have to have realistic expectations and I have to be able to meet those. And I think that's really important. So this goes back to going to a surgeon who's not going to meet you the minute before surgery. They've never had that conversation. You don't feel that comfortable, connection with the surgeon that can provide for you what you want. So you should go to somebody who's going to take care of you, make sure that your labs look good, make sure you're pre-oped well, and gets to know you a little bit before you just have surgery. What else do you want to know?
Like what would be a good size for someone my height and my weight? So I'm 4'11" and I weigh around 100 pounds.
Okay. It has nothing to do with that, actually. So people get caught up in, well, my friend has 350s and my friend has 450s and this, and that's not how it's done at all. It's all done by proportions of the body. You're changing your geometry. So basically I measure the width of your breast, the base of your breast. That's going to give me the diameter that I should use for your implant. There's 600 different sizes of implants. So you go to a doctor that says, 350, 450. No, it goes up by 15 cc's each time. So this is a very intricate procedure and should be done so. So we're going to measure your width. I'll tell you, well, you are going to fit within this size range. And it could be about 60 cc's, give or take. And 60 cc's is not a lot. We're talking about 2 medicine cups of like NyQuil. So if I tell you in the OR, I'm going to bring in a range of implants, I know the look you're going for because hopefully you have an image that you kind of want to look like or something. You show me that and I'll talk about profiles and, is it a high profile or a full profile? We go through kind of the look of the cleavage you want. And then from there, I use sizers in the OR, which are like basically airbags. We dissect the area, put the airbags in, blow them up to the appropriate volume, make sure you look perfect, the way you would kind of want to look. I take those out, clean up the area, make it all look beautiful, lots of antibiotic irrigation, and I use what's called a Keller funnel. It's a funnel to put the implant in through a very small incision, 3 centimeters, in the crease of your breast.
There's no touch technique?
No touch. We do not touch the implants at all.
That's standard of care now, isn't it?
It's not really the standard of care, but it should be. It should be. Right. There's articles, even as recent as the most recent journal came out, that states that, number one, you shouldn't be putting implants in through the nipple anymore. That's the highest rate of capsular contraction.
And you're talking about periareolar?
Periareolar, correct. Around the areola. These incisions, they're the worst for capsular contracture. And then, we put it in underneath in the crease, and we don't touch the implants at all. They're bathed in antibiotic solution with betadine, as you know. And then we funnel it in. I check to make sure the seal is permanently placed against the chest wall, which is make sure the implant is properly oriented. We close up. It takes about 25 minutes.
Wow.
25 minutes?
If I do what's called the dual plane, which is one of my signature techniques, it might take up to 40 minutes, depending on the type of breast shape you have.
Am I sleeping
You're
during the
completely
procedure?
asleep because we have to go underneath a muscle, and there's a lot of muscles in your body, and a lot of them help you breathe. And if we're going to paralyze one muscle, we have to paralyze all the muscles. So you're going to be under general anesthesia for those 25 minutes while we do this breast procedure.
Does it hurt after?
It feels like a pressure. I tell patients it feels like you have a chest pressure because your muscle wants to contract. Now it has this implant underneath. Now in patients like you, I get a lot of fitness, guru type patients. You can no longer work out chest afterwards. You're not allowed to do any chest exercise because you will displace the implants.
For forever?
Down and out. You should never sleep on your stomach, and you really shouldn't be doing chest exercise.
For how long is that?
Forever.
Like you can't do push-ups?
No, you shouldn't do push-ups or long arm planks.
Pull-ups?
Nope.
Because you see all of them in the videos.
Because what happens is your implant, your muscle, you know how the pectoralis is shaped, it pushes the implant down and out to the side every time you contract. So you don't want the implant sitting in your armpits. So these are things I discuss with all the patients, preoperatively, and say that you're not allowed to do these things.
And does it matter the location of the implant, or is that for any location for a breast implant you should
if
not
you do so there are some athletes I do, bodybuilding, all that stuff. We do it pre-pectoral, meaning we put the implant in underneath the fascia of the pectoralis.
Right.
So they can still work out their chest afterwards. But that implant looks really fake sometimes because you just have like an implant above your muscle and it doesn't have that nice, natural, gradual slope to it. It just looks like...
But it's better than a complication of a displaced implant.
Correct. It can be, but you have a higher risk for what's called capsular contracture when you don't put it underneath the muscle.
Is this implant forever, or do I have to replace it in the future?
It's a good question. Historically, the stigma was you had to replace your implants. Saline implants had more complications within a 10-year period.
What kind of complications?
Typically, they would have capsular contracture. It's where basically the breast gets tight and hard, and it happens because of an irritation.
And there are different grades, right?
Different grades. Grade 4 is the worst. It's where it's painful.
I know someone who got grade 4 after like a week.
That can happen. It can happen.
Bilateral.
But, it's usually done, that's usually associated with that periareolar incision, typically. But saline implants, were typically, you want to take them out 10 years. Now you're asking me, they have a lifetime warranty, actually, the implant itself. So if you were to not go through pregnancy and breastfeeding or gain weight, lose weight, and you love the shape of your breast and you never had an issue and you constantly check up with your plastic surgeon as you're supposed to every 2-3 years, make sure everything still feels and looks good, you can keep them longer.
So I saw a picture once of a girl that got her implants removed, like her boob job.
Correct.
She took it off. And I saw that the body had kind of built a tissue around the implants.
That's a capsule.
Yeah.
That's the capsule itself. You always form a capsule. Your body walls off foreign bodies. So your body builds a thin layer of what's called a capsule. It's basically scar tissue that forms around the implant. Most people, most of the time, this stays soft and you don't even know you have it, and it's fine. But when you take them out for breast implant illness or any other reason to take them out, you typically take out the capsule with it. The body can absorb it, but it's just better off to take the capsule out with it.
What are the implants made of?
The implants are made of a silicone matrix that's cohesive, meaning I could cut the implant in half, hold it upside down, like the famous Dairy Queen commercial where they hold the blizzard like this. You probably don't because you don't eat ice cream. But anyway, so, basically you could hold the implant up and nothing goops out of it. It's not like a viscous liquid that's just going to fall out of here like water in a glass. It's actually sticks together. So you have what's called silent ruptures if they rupture. If you're in a bad accident or something were to happen to your chest, kicked by a horse, I've seen it all, that can cause what's called a silent rupture. You'll get a crease in the bag itself, and it needs to be seen by an MRI or an ultrasound, and we would change it out.
And there's no way that the implants can leak into your lungs or anything?
Just like we talked about, we just had a capsule. You have a capsule that surrounds it. And sometimes that capsule can get irritated. I've done disaster cases where they've had them in way too long, and they were older style implants, earlier generations. The capsule's like an eggshell. It causes bleeding. And I've done a lot of big reconstructions where you can't just take implants out and put new ones in. You have to let the patient heal. Their body has to heal. And then,
all right, guys, we're back with our plastic surgery series, part 1. We're talking about pretty much everything plastic surgery, no limits. Talking about, the path to get into plastic surgery, to become a plastic surgeon, the types of procedures that you guys see and do, and then, the problems that can occur in patient selection, and if it's right for you as a woman or a man to have these procedures done. So I think we touched on a lot, and we provided a lot of value for people, and I think a lot of questions were answered.
They're not sleeping.
Nina asked some amazing questions that I would never even have considered. So I thank you and appreciate you for that.
Thank you for having me.
Of course. And, this is just the beginning of what Friends of Medicine as a foundation is going to be offering to all our audience, all our viewers, all our followers, bringing value to you, bringing topics and discussions and awareness on certain things that aren't discussed enough in our communities, and basically bringing professionals like you guys to the table to teach us all on these issues that we're not really familiar with.
Yeah, thanks for having me. This was great.
I love it. This is like a very unique concept. I've never heard of anyone doing anything like this.
That's because it's not being done.
It's not at all.
I appreciate that. It's been a long journey so far, and so I think everything that we've been through, all the ups and downs have been worth it, and we're just getting started. We're going to have so many experts on this show, and we're going to have so many different events that incorporate all industry experts, from teachers to athletes, entertainers, luxury yacht brokers have come to our events, and of course the professionals like the lawyers, accountants, the fitness world, the cosmetic industry. There's just so many. It's countless.
Yeah, there's endless.
And there's so much that we can discuss and teach each other. So this is the beginning. We're pioneers, and I appreciate you guys coming on the show.
First of many.
First of many.
Stay tuned, guys. There's more to come. Thanks for joining in. Friends of Medicine podcast. Uncut, unfiltered, raw to the flesh. make sure you click the link below. Go to friendsofmedicine.com, www.friendsofmed.com. Visit our Instagram, friends_of_medicine. And you can find out about when our next events are. Come and meet these doctors, network, and take your network to the next level.